Hello, and welcome to another episode of Ask the Doctor with Dr. Jeffrey Sherman. I would like to start off by saying that it is the 14th of May, and the CDC, as of today, reports there are 1.3 million cases of COVID-19 and 84,000 deaths in the United States. That's like a timestamp for, I guess, the progress of this scenario around this episode.
Right.
So we have Sherman again. Thank you for being here.
Yeah, thank you for having me.
And it's always been an honor. So let's see. Last week, we went into stuff about zinc. And I have now with me zinc supplements and also these coldies, which use the ingredients of zinc.
Right.
Is there really like a difference to using them?
No, you want the elemental zinc. You want, 13, 15 milligrams of the elemental zinc. The cold ease is good. It's a lozenge, so it gets absorbed quicker.
Okay.
So in theory, what you can do is, when you're going out to the park or going for a walk, you can sort of take, those are your quote, more riskier moments. You can take that lozenge right then and there as you're going for your walk or going to the park or whatever you're going to be outside. And that's a quick absorbing mode of getting zinc right into your system. So if you're getting that virus at the park or outside, it's circulating in you at its highest levels at that moment. And so you get a really good response. You get a really good protective effect. That's not to say the other ways of taking zinc won't work. They will. But the lozenge is a really rapid way of absorbing it, and I think you get the most bang for your buck that way.
I didn't actually know lozenges.
There's been a run on the coldies. It's hard to get them sometimes, but I think Amazon's caught up to the demand by now. You can probably get them at the stores too.
Yeah, I didn't actually know there's a difference between lozenges and pills. They're structurally different so that they absorb quicker, I guess.
Yeah. Well, it's the tongue. It's the under the tongue and the tongue and the absorption here better than the traditional gut absorption. It gets absorbed one way or the other, but it's a little quicker through the saliva
under the tongue.
Right down up there. Yeah.
And with, I guess, regular raw zinc, vitamin pills.
Yeah.
These are also zinc, so they should work. They'll just take longer because they require stomach absorption.
Yeah, but you take them every day,
right?
You're gonna get it all, absorbed. And if you take it every day, it gets to the therapeutic level, and it sustains that therapeutic level. So either way, you're getting the right amount of zinc. My point is, at the height, you can get it absorbed with the lozenge.
Yeah.
And that way is very, very good. Those lozenges don't taste bad either. They do leave a little funny aftertaste. I've been taking them myself the last couple of weeks, and it's almost like a candy at the time. And then afterwards, it does leave a funny aftertaste. So for a while, for me anyway, and so what you're eating tastes funny. There's a different taste to your dinner, for example, if you go on an afternoon walk. But big deal. It's worth it.
Yeah. That's a good point. Yeah. And the dose is 30 milligrams per pill for this. And I was just personally surprised. I thought it would be a lot higher is what you're supposed to take, but I guess it's not.
Yeah, zinc isn't as, in terms of milligrams, not the most, weighty necessity in terms of, what you daily need. 30's beyond enough. In fact, it may, you may excrete the extra what you will not be circulating. So, like that.
I'm curious. So this also actually says that it has vitamin C in it. I'm kind of curious if vitamin C is actually really cheap to produce, because I've seen lots of fruit juices that like to advertise they have like 100% daily value of vitamin C in them, which I feel like is like, if everybody's doing it, then it must not be very taxing.
No, it's easy to get. It's easy to get naturally, easy to get, manufactured synthetically. rose hips are something you see with vitamin C all the time. I don't know. I don't think necessarily that's needed in everybody's case. As long as you get your vitamin C with an orange, a grapefruit, or a capsule, it's fine. Rose hips or not, that helps the immune system. There haven't been really any. There's no data I'm aware of that correlates any vitamin C levels with COVID response. So it's more of an immune system booster, as just a lot of things are.
Yeah.
But that's where vitamin C's role plays a role here. It's in the immune system.
For today, I have a variety of different protective gear that people might come across, whether online or outside. Of course, let's see. I have a standard surgical mask, I believe it's called.
Okay.
Yeah, this is just everyone should be wearing something like this where it blocks your output. And
yes. The output.
I'm very fortunate that I have one of these. I actually have this because we had these in our apartment before COVID was a thing. We actually had these to prepare for an earthquake because of all the dust and debris in the air.
Be on the ball.
Yep. And I guess this is the standard thing. This is
in that small print there. Does it say N95 on there?
It actually says N99. I don't know if it's going to be reversed on camera. Oh no, it's good on camera. Oh, that's the details.
So maybe that's even better than N95.
Yeah, I think it's supposed to be.
But my point is, it has to designate it on the mask, on the package, and on the mask itself for that to be considered. Right. And that protects the user. Really, it protects the environment and the user. It can't be penetrated. The surgical mask you have there does prevent 95% of the material from going out. And a lot of the stuff from coming in, but not the shield that the N95 is.
Right. Okay.
So there is a difference. The point of wearing the surgical masks are to prevent outgoing germs to other folks, which is how this thing spreads. If you can prevent it from going out, you're doing a hell of a job. The N95 being used in the medical environment protects protects the healthcare worker from patients we know are positive.
Right.
We'll put masks on those patients in the ER, but still, when they're positive, you got to wear that N95 to protect yourself. So there's that one too.
Now, I guess COVID-19 can probably it travels into your body via any mucous membrane, as long as it gets there. It's just that breathing is the easiest way to get it. But given how it can go through the mucous membranes around your eyes, goggles, I guess, could also be useful if you're in a high density zone.
Those are very good goggles. They got that side protection.
Exactly, yeah. I had them for lab.
It forms a nice seal around the entire eye area. That's very good. So goggles, a face shield, a clear face shield. You may or may not have that, but the goggles are good.
Actually,
eyeglasses are baseline. Okay, that they are helpful, but you got the sides. Those goggles are good. A face shield is good, which forms around the face.
I was going to ask you about that. I do in fact have a face shield. I thought it was ridiculous because if it's not airtight, I was like, oh, the virus can just go under. But I guess is that not the case?
I guess in theory it could, but you see that thing, it wraps around your face a little.
Yeah, something like this. I can't really wear it good with headphones on.
Yeah, but that's a pretty good barrier against what we're fighting. Now, it doesn't leave the seal that the goggles do, but you're doing a pretty damn good job of blocking your eyes with the shield you have there in terms of having the virus trying to do a roller coaster route into there. I think
if a virus is propelled at you, then a shield will block it, a windshield, I guess, on a car.
The droplets, as we may have discussed before, in normal speech, go a couple of feet and then kind of die down. A sneeze indoors can go up to about 12 feet. A cough can go up to about 9 feet.
Wow.
That's uncovered. Of course, you got to do the elbow. And even then, it does go out a little bit. But with the mask, if the person wears, the sneeze kind of goes locally, and if the healthcare worker or another person is wearing their own mask, you're getting protection from that too. So these particles are out there. You just can't say, "Oh, it's not there," and you got to,
Yeah, because you can't really
guard
know.
up at all times.
I have a mask here that was advertised as being P95 or N95.
Yeah.
And, well, it's just structurally very different than this. I mean, for one, it's not firm
Yeah.
like this one is. But it does have this little, I guess that's the filter.
Yes.
I guess that is what this is. And I've noticed that's a trend with like any of these masks that have some kind of N rating,
Right.
is that they have this nodule on them.
Right.
And I guess, does this kind of mask work, I suppose?
It does work. It doesn't work as well as the 95. Part of there's a couple of things about the N95 that make it what it is. One is the material it's made of, the thickness, and how things mesh together. You may notice that the one you're having there now is a little bit softer, a little bit more flimsy.
Right.
So that one, while it's still quality, it's not as impenetrable as the N95. Also, the N95 with the rubber bands that tie all the way around the back of the head and the cup shape to the face make it a nice firm seal around the skin, which is key. The ones that attach to the ears still leave a little bit on the side to so that seal is not as firm. So you're not getting the exact what an N95, but it's still very good.
Mm-hmm. And let's see, we have a question about how does COVID-19 sometimes cause a loss of taste or smell? Like, what is it suppressing, I guess, in the body? And yeah, that's a question that I think, have they even figured it out completely?
Not sure about that. It's obviously a central nervous system thing. That's why this virus is difficult. It affects multi organs, and I think it's has to do with the brain and the signals to those the senses through the nervous system in the brain. So it's something to do with that. It hasn't affected the brain other ways, vision loss, slurred speech, TIAs and stuff like that, at least as we know. However, we talked about the hypercoagulable state and with TIAs there, but attacking other nerves per se, neuropathy, trouble swallowing, muscle weaknesses and things like that, it hasn't done that as far as we know, but it's a central nervous origin. We're still learning about it, but that's why it affects the sense, smell, and taste with the cranial nerves.
And I guess what's important to know is that the coronavirus family does include common cold, right?
Yes.
So
cold and flu.
Those viruses do make you lose a sense of taste or smell, but that could be mostly attributed to just the thickening, I guess, of your nose.
Yeah, probably that the mucus, the secretions. Unclear as to if it has to do with something centrally, but it does have to do with the mucus and secretions most likely, and that's what's going on.
I wonder if taste and smell is affected more because the olfactory nerves, I guess, are more exposed in the
they're attacking those nerves. I mean, the nerves hook into a cranial nerve to the brain, so it's on the nerve itself or part of the brain that controls that. So it's along that pathway.
There was a couple studies done recently about there's a correlation between countries with overall low amounts of vitamin D in their people's system and with an increase in the severity of COVID-19 cases.
Yeah, and of course, D's been looked at as a correlation, right? There's no cause and effect, but the sicker patients, the patients who haven't done as well, were low or deficient in vitamin D. Mainly, sure, elderly folks don't get enough vitamin D, don't get enough sunlight, may not be on supplements.
Exactly.
What the thinking is on the vitamin D is the lack of vitamin D or the lower levels of it contribute to the hyperimmune response,
Okay.
the immune system response, and contributes to what they call the cytokine storm, where your own immune system attacking your
Yeah,
lungs,
everything.
attacking your own organs. Your immune system is supposed to attack the virus and the virus's pieces, but in the cytokine storm, and that's why patients are doing so poorly with is where it attacks your own tissue. And those patients in retrospective studies, and nothing that's been published yet, but something that's on the
Okay.
verge, have been associated with that lower vitamin D level. So I would just add vitamin D to the armamentarium of some of the supplements we take to avoid the cytokine storm. You want a strong immune system, but you want an overpowering immune system. You want that
Right.
vitamin
Yeah.
C to help your immune system. You want that 6, 7, 8 hours of sleep at night. You want your biorhythms to be in order, and then but you don't want it overpowering to the point where you get the cytokine storm. So you take enough vitamin D to help with that, and things should be okay. But it's like I said, the data is there. It's not published. It's being looked at, but it's pretty convincing so far.
Right. And yeah, it's something that's very important to remember about correlation is that correlation is not the same as causation.
Right.
In that if you see if any study that you read or article that talks about it mentions there being a correlation between two things, you have to always remind yourself that it doesn't necessarily mean one does cause the other. It could mean one's causing the other, or the other thing's causing the first thing. For example, COVID-19 patients who have a severe condition could have a low amount of vitamin D because they were just in a hospital all day, throughout their time, so they just didn't get much sunlight. Or it could be that they didn't get much sunlight and so their condition got more severe, requiring the hospital. Or here's the third option: both conditions were caused by the same thing, in that doesn't really work with COVID-19 as much, but you could have some third unknown variable be causing both conditions of low vitamin D and the severe COVID-19 infection. Of course, in the case of a COVID-19 infection, it's probably the virus. Now, something else that's interesting about the immune system attacking itself is that there's kind of actually been a trend of autoimmune disorders in the US, of things like, I think does diabetes count as an autoimmune disorder? I don't think so.
It's an endocrine disorder, so
Endocrine, right.
it's its own little category.
Arthritis.
Yes.
That's the one. And there's some heart conditions as well.
Right.
It seems that people's bodies these days, at least in the United States, I know, are being more hyperactive against themselves. So that could actually, I guess, put everyone at more risk for COVID-19, if that's the main method that COVID-19 does damage.
Yeah, it does. It activates some of that. It's part of this whole cytokine storm thing, and your own immune system being too strong, and that's a baseline medical issue. Arthritis, lupus,
Right. Yeah, lupus.
Rheumatoid arthritis, mixed connective tissue disease, Sjogren's syndrome. The rheumatology family of diseases is the immune system being a little bit too overactive, and those patients have had a tough time during the COVID times.
Yeah. Let's see. Another thing I wanted to talk about vitamin D is how we always say go out in the sun to get vitamin D.
Yes.
I mean, that is effectively true, but technically, when you go out into the sun, you're not directly getting the molecule of vitamin D. You're getting like a tiny thing called vitamin D3, and that reacts in your skin cells with, I believe, cholesterol, reacts with cholesterol to make vitamin D, and then that's put out in your blood. So
yeah, it's a chain reaction of things that is triggered by the sun through the skin. Yeah, vitamin D is not floating in the air, so you're seeing
right.
they're turning into the vitamin, biochemically.
Yes, and one thing that I found kind of interesting is that if vitamin D is actually made from cholesterol, then that made me wonder if you had too low cholesterol levels, that could actually influence how much vitamin D you had if you didn't have enough in your skin cells out in the sun.
Perhaps, yeah, you may have a tough time absorbing it naturally, but
More
that's
research has to
no
be done.
reason to quit taking your cholesterol medicine.
Yeah, there's
I think the
good
benefit of
reasons.
a low cholesterol outweighs the risk of the heart disease from the higher one. So take the vitamin D, But that is an
Supplements, yeah.
interesting point. I mean, you do make an interesting point that it is a cholesterol. I mean, cholesterol has a lot of things. I mean, cholesterol is part of the digestion with the gallbladder, and I mean, we need
it. Makes a lot.
We make it. It just is not. You don't want it too high. So there's a middle ground for everything there.
Yes, I guess it's also important to remember that, like, basically most Western medicine has side effects, I guess. So it's just important to know what they are and accommodate for them, such as being deficient in vitamin D. Well, then you take vitamin D supplements and you will be okay with that.
Yeah. Now vitamin D, remember, you need that for your bones. Vitamin D by itself isn't all that great. You need calcium and then the vitamin E together to mineralize it, and that's where you get the stronger bones, teeth, and things like that. So get your calcium as well. Keep that in the normal range as well. You don't want to get too much calcium, causing kidney stones or
calcification,
and the other symptoms that come along with that.
And calcium, of course, people always associate it with milk, but it can also come from meats, and I believe plenty of vegetables as well.
Yeah, exactly. But in patients who want to avoid osteoporosis and need the strong bones, you need a little bit more than what you're going to get dietarily, and so you get a little calcium supplement, calcium chews, calcium carbonate, like Tums, which are great sources of calcium, or just these little gummy calcium things that are always pretty good to build the bones, along with vitamin D. Build the bones. Don't want to break a hip.
Yeah. Let's see. So for people that are quarantining, which should be most of us, except for the essential workers, thank you. Because we're going to be basically using our same air all the time. I know that's not really relevant because it's there's enough oxygen, there's enough air circulation, but basically I just wanted to ask about the effectiveness of air filters on if you think you might be sick, should you have an air filter in your living space, just for any kind of reason that could be useful for?
Yeah, I think you should. I'm not so sure the filters, I mean, they're going to help clean the air and help you breathe better and give your lungs the best chance. Are they strong enough to trap the virus? I don't think so. However, you would be double check, and if you're in a single family home, it's your own house recirculating. If you are in a apartment complex, multi-unit building, make sure that the air just still circulates within your own unit and doesn't circulate throughout the building.
Okay, that's
I think if it does circulate, you're a little bit of a higher risk. With even if you're home, you'll have the other people's air coming through and around in your space. So the air filter is good to trap dust and to give your lungs the best chance to be healthy. The virus does not get trapped with those filters. And just make sure that you're not recirculating other people's air too.
Yeah, like HEPA filtered.
If building wired, so be it. But I mean, that's something you got to look into.
What about activated carbon filters? Are those powerful enough, or you think because viruses are so tiny?
Yeah, I'm not so sure about that.
Okay, yeah. Let's see. We have another question here about the clinical trials of a vaccine. How would clinical trials of a vaccine work? Do people need to be exposed to the virus after vaccination, or do they see if they happen to get it?
That's the phase 2 trial. They give the vaccine and they give the exposure to the virus together, and then they give the other people nothing and compare how they do.
Right. And of course, there's questions of ethics.
If things are going well, they because they want to make sure the people don't get too sick. So they give a few people that. So yes, you got to give them the virus, and people volunteer for this. They give them the virus, and they see how they do with the vaccine. And if things are going well, then they start to ramp up the number of people try, because they need a big sample size.
Yes, they need to be able to accommodate for all randomness.
So once it's deemed kind of safe and not too many people are getting sick, they can kind of mass test, and that's the phase 3. And once you get past phase 3 and things are looking good in terms of response to the virus, then they can say, hey, this is a reasonable vaccine, and they can start to mass produce it and try to get it available to everybody.
I believe
final approval once the study
approval.
and the trial are concluded.
I believe I believe they've already tested some vaccines not on humans, but on closely related primates. Do you know anything about that?
That's part of the phase 1. They use animals.
Part of the phase 1. Okay.
They use animals and laboratory stuff. So they'll try to get they'll do it in test tubes or PCRs or assays and things in the lab to see responses to the vaccine or to the way they're trying to get rid of the virus. And then once the data is looking good, that's when they put it in the small phase 2, the small population of people, and get a real response, and then move on to the phase 3. So that's and each phase takes a couple of months. That's why this is not right away.
Right.
I mean, you got to get some data. The more data, the better. But we're trying to ramp this thing through pretty fast.
Because part of that data is time itself.
You can't speed up time in certain areas. You just can't do it. There's different ways to do a vaccine. There's messenger RNA, trying to replicate part of the virus, trying to replicate part of the virus to build your own immunity against that little part, or just try to build a look-alike receptor target to block the receptors so the virus can't latch on to your body's host receptors.
Okay.
So there's different ways to do this. Each requires the same kind of step-by-step trial process.
Yeah, I was actually wondering that, because a vaccine isn't as simple as just like killing a pathogen, putting it in a tube, and then putting it in your body. There's a lot more that goes in there.
Right, and they gotta map out the genetic material from the virus in some cases, and to replicate it. So they gotta identify it, and then create it, and then inject it and see if it works. And it's a hours and days painstaking process a lot of the time, and it can just take some time. We're on our way, but there's still some time to go. And even the vaccine, by the way, might change. The flu changes year to year, and the flu's only good for a year. I mean, you get some vaccines when you're a kid against measles and polio and stuff like that. That's all good. Those last, but who knows what this virus is going to do? We might need a vaccine every 5-6 months. Who knows?
Right, and then we have to create like an infrastructure for just the purpose of creating and distributing COVID vaccines.
There's a lot of people out there, and you got to get it everywhere.
I'm curious, actually.
Urgent cares and places like that.
So because there's a flu vaccine every year, I guess there must be some kind of chain that has been created, some kind of infrastructure chain that's been created for production of the flu vaccine every year. And I guess modeling that would be how we need to freak out about this COVID-19 vaccine, is we model it, and then...
Yeah, the flu vaccine is mass produced, but we would need even greater scale for this one. I mean, I don't know. Do half the people have the flu vaccine? Maybe half. Certainly the elderly population would. I know personally, until a couple of years ago, I never got it. Now I've been getting it. My point is, not everybody gets the flu vaccine, but everybody's darn going to get this COVID-19 vaccine. And so you got to really make it mass. You're doing billions of doses here, and I think it's going to take several pharmaceutical companies to team up and get it done. It's not a time now for being, patent and first to the patent office. It's Just let's get everybody on board, work together, and get it going. If two different companies come up with it, let's do it. Yeah, but let's all team up and get it out to everybody. But it's a bigger ordeal than the flu, which is a big deal too. You're right; that happens every year. But this is going to be a bigger thing. It's just got to be produced, distributed. The pharmacies have to, there's going to be probably lines. I mean, it's just got to get it done.
We have a question here about, so why do some diseases don't have vaccines, such as the HIV virus? I think that's redundant.
Yeah, good question. They just haven't been able to come up with a vaccine. Not all viruses you can't fool them all. HIV's a tricky one. Instead, they've come up with tremendous, antiviral meds to prevent its proliferation. So, which is almost as good as a vaccine. It's in the way the virus behaves, the way it kind of protects itself, and who knows? I'm hoping this virus doesn't act like that.
Oh yeah, that would be bad.
But
luckily, it's in the same family as other viruses.
So that may, the family comes from the corona, the corona family, the flu, the cold. Those have been vaccinable, but you never know. But it's just the way the vaccine, the bacteria, the virus, the nature of it. Some can't be vaccinated against, and then there'll be good therapy. I'm hoping for good therapy on the COVID too. I mean, you need some good therapy. What we want to I want to see some trials. I'm not aware of any on some good, like preventative, like the trials on the quote healthy patients. We've seen the trials on the sick patients in the hospital, and there's some good data on some sick patients with remdesivir. I want to see something on the outpatient. I want to see something on the patient who either doesn't have it to prevent it, or who might have it early on to get rid of it so he doesn't really become symptomatic and can't spread it.
Right.
I want to see something like that. That's going to come down the pike, but can't come soon enough.
I guess we're just being overloaded on all the sick patients that we can't even accommodate for the not sick.
Rightfully so, and a vaccine too, yes.
It's what's kind of funny, not really funny actually, not funny at all.
Peculiar maybe.
But yes, peculiar, is that in Germany, Germany has multiple times more beds than they predict they're going to need, because, well, not really because, but they just have a surplus of bedding for sick patients that they've even been sharing with countries that are near them, and that kind of showed to me how different, I guess, each country is in its health infrastructure, and some countries just weren't prepared for something like this. And it's not like Germany specifically. I mean, I don't actually know whether this is true or not, but it doesn't necessarily mean Germany prepared for a pandemic. It just means that they had more infrastructure available and they could use it. I was kind of curious if that was it was leftover from World War II, not really related to what we're talking about, but just if they had lots of beds
so. A lot of stuff
for soldiers.
Germany in World War II was, leveled and destroyed. They may have come back a little bit stronger and rebuilt things in greater quantity or volume, but I think it's been too long for any World War II stuff to be lingering around.
That's a good point.
They leveled the cities of Berlin and many other cities around there. The hospitals are newer, and they just have. It comes down to, they have. It's a cultural thing. The Americans, are more on the obese side. They're more on the, they're more on the it's all about me side. So their health isn't great. So their hospital beds are going to be more full. And other places like Scandinavia and Germany and places like that live generally a healthier lifestyle. So the hospitals tend to be more open most of the time, and they're therefore are more capable of handling the spike when it comes on. I think that's part of it. And if we look at this as a teaching moment to say, hey, let's get in better shape so we're in better health, that's what's going to help us the most down the road. Yes, we have to self-isolate and do all that, but getting in better shape is going to help us down the road against things like this. So
exactly, yeah,
the vast majority of us who do get it can yes, we'll be a little sick, but we'll stay at home and we can handle it there, as opposed to having to go to the hospital. I think that is what was the reason that some of those countries did better than we did.
Yeah, and like in some probably not just the Asian countries, but I know that it's a common social practice there that if you have any kind of symptoms that could release a pathogen, they just wear a mask normally. Yeah. Everyone did that already, so the transition wasn't as stark for them, although they were at higher risk because they were closer to China.
They were ahead of the curve, wearing those masks all the time, and that does work. That does work. I just would like to see everybody doing it. It's gotten better, but I still see a few folks who do not wear their mask, and it's a little bit, whatever. One thing
I realized that I think really does highlight the problem is about the mask wearing, is that I saw an interview of a doctor, or like a doctor who's like not a doctor anymore, and she was saying how she doesn't like to wear a mask because it's re-inhaling viruses if she's sick, and that like suppresses her immune system. Which, it's like, even if that's true, you can kind of see how her thinking is individualistic, where it's like, I don't want to re-inhale my viruses and make me sicker. And even if that's true, you can see the flaw in that. It's like, well, you should probably be inhaling the viruses rather than somebody else. That's the point of the mask, is like,
right. And I understand that, or why she would think that, but the amount of virus she's re-inhaling, quote unquote, if that's the case,
right,
is a tiny fraction of what is multiplying in her already by having.
Your body has way too many viruses when you're infected.
If one virus gets absorbed in the lungs, 500 million come out, and maybe whatever's out here is negligible compared to what's brewing in there. If she's already got it,
you're right.
Her immune system's going to overcome and who knows? I mean, it doesn't mean she's going to be any worse. My point is, she should wear the mask and not really think that, because whatever's already inside her is more than enough to give her anything she's afraid of getting in the first place.
Yeah.
It's
kind of interesting how history became that way, where we evolved from the 60s was like a revamp to stop caring about like regular society. Everyone's kind of chilling. And then I think that evolved in the 70s to become like self-esteem, like I feel so good now. Right. And then that turned into materialistic a little bit with like the whole I feel so good now thing. But
yeah, it goes in ways, and then soon enough it'll back to the other way, the altruistic way and whatever. But it's the me, look at me generation now. Everyone wants to be front and center on their YouTube, Instagram, whatever those things are.
We can't really criticize how it's become, because it's like, it's kind of out of our control. It happened in the past already, and it's like, all we can do is try to just teach whoever we come across, and to teach politely, because that is the best way to tell somebody information.
Exactly.
All right, I think that's a decent place to end off the episode. Oh, okay, hold on. One last question here.
Okay.
Okay, so people do have concern of breathing in their own CO2, if that can cause lightheadedness, and thoughts about that.
Yeah, it does if you do enough of it. That's what these breathing into the bag. Now that it does give and take. You're getting more CO2 than you normally would, yes, but not
right
to the point where it's going to adversely affect gas exchange. Of course, that would never. And that mask like that would never fly. The CO2, you got to breathe into a paper bag, hyperventilating.
That's really what does
trouble. But in terms of breathing your own CO2, and you're not getting the 21% oxygen maybe, but you're getting enough to continue. Yes. No, you can't jog in the N95.
No, that's very important. Okay? You cannot jog.
That's the problem. But you're not jogging when you're doing that. You're working. And you'll take a break and clear out and then get back in there. I mean, yes, the N95 is an uncomfortable thing, but it's going to be uncomfortable, but it's not going to make you lightheaded or pass out.
Right, yeah. And one thing that's very important to know about breathing is that It's not perfect. And what I mean is that whatever you inhale isn't going to be perfectly stripped of oxygen. That's just not really biologically possible.
Yeah.
That's why you can resuscitate somebody by breathing into their mouth if they've like
So you're
swallowed
still
water in a
exhaling
pool.
oxygen there. Sure.
Yeah, there's enough oxygen in your breath, in your exhale,
Yeah.
that you can like give some kind of oxygen exchange to someone who's not breathing.
Right.
And
you give enough to stimulate their own breathing. Then when they're able to come to
that's how it works.
breathe on their own, they get there. But yeah, you're exhaling oxygen also. I mean, oxygen, you're breathing in oxygen 21%. I don't know what you're exhaling, but it's not zero.
Yeah,
I mean,
it's not going to be zero.
Is nitrogen, so you're breathing 70% nitrogen here, 75% nitrogen.
Easy to forget that.
Yeah,
Nitrogen's everywhere.
Don't think it's nitrogen is what's around you, and there's oxygen, which is what helps you, and then you breathe out oxygen too, and then the plants breathe it, and it's all the plants.
Yeah, there's the cycle.
But you are not inhaling 100% oxygen and exhaling zero. You're inhaling 21 and exhaling,
somewhere between.
Somewhere in there,
yeah. All right. This has been a very nice episode of Ask the Doctor with Dr. Jeffrey Sherman. It's always an honor to have you here.
Appreciate it. Thank you for having me.
Let's see. Time for the plugs of your contact information and email. Tower Gastro
at gmail.com, towergastro@gmail.com. Email with any questions. Also, you can visit the website for some interesting information on GI issues and COVID, jshermanmd.com.
Okay. All right. And thank you, everyone, who participated and came here to the show. We will see you next week at 3 p.m. same time, Thursday. Have a good day. Stay safe. Wear those masks.
Yes,
try not to use Advil and Aleve. Those can increase your risk of catching the virus and making it worse. Disinfect your hands with soap and water. Your food with soap and water. Don't dish soap. Dish soap is safe. All right. Bye. See you next week.
Thank you. Have a good afternoon.
You too, Sherman.
Yeah.